Kia ora, thank you for joining us this morning for this live COVID-19 and influenza discussion. My name's Hannah Martin, I'm a health reporter here at Stuff, and today I'm joined by Director of Population Health at Counties Manukau DHB, Dr Gary Jackson, Dr Christine McIntosh, who is a GP and the COVID-19 program Home Isolation Director, and immunologist Dr Anthony Jordan. This morning, Gary, I'd like to start by addressing the Omicron elephant in the room. Are we expecting a second wave of the variant this winter? Is it already happening? What does the modelling show us?
Yeah, it's really interesting. There's lots of different scenarios you can put in depending on which assumptions you make about the virus, but almost doesn't matter which assumptions you put in, there's clearly going to be another peak, a second peak, and we've seen that in countries all around the world, that you have the first peak and then you have a second week. And depending on your precautions that you're taking, how well your population's using masks and so on, is kind of how fast that peak arrives. So at the moment, we've got three different scenarios we're looking at. One starts kind of next month, one's more August, and one's more kind of September, October. At the moment, the way that the data is tracking, we're looking more like the earlier one, so it's looking more a June, July kind of peak. Unfortunately, that puts us in the same boat as a number of the other winter viruses that are also coming along. You might have heard in the news, the influenza has started, so students in both Auckland and Dunedin have getting influenza A already, so we're possibly going to have an overlapping winter.
Is that early for influenza?
Yeah, it is kind of early. Generally it's June as a standard year, but it can move from year to year. Where we're worried about flu is that we haven't had any flu for the last 2 years, so you've got a kind of an extra susceptible population, and so more chance of people actually getting a slightly more severe illness with it. So obviously the vaccination is going to be key to help ameliorate some of that.
Yeah, sure. And you mentioned that we could have sort of a coming to a head of respiratory illnesses more generally. I guess this is one for the floor. What if we do see a resurgence of COVID in line with flu, RSV, other sort of, winter coughs and colds, what could that look like in a community sense, but also, I suppose, for our hospital sector?
So I think it's really important to realise that that COVID is just one of the respiratory viruses, and we do have all these other respiratory viruses which normally cause problems in winter for families and communities. So RSV is the virus that causes bronchiolitis in babies. So if you've ever seen babies struggling for their breathing, that's the virus that causes that. And we see flu happening in babies, but also more vulnerable populations and pregnancy and things like that. So it's really important that we realise that we've had closed borders for the last few years. We haven't had the same exposure to these viruses in our community. This year our borders are open. That's really exciting for many reasons, but it's also going to bring these other viruses into our communities again. And so we're going to have both the combination of that COVID and all these other respiratory viruses going on as well at the same time. So I think it's recognising that actually that is going to impact us. We have to behave differently perhaps to what we did in the past when we were unwell with a cold or flu. We need to stay home. We need to stop the spread of whatever we've got, and definitely need to register if it's our COVID. We've got COVID, we need to test for it, but we also need to recognise we've got all these other viruses going on in the community as well this winter.
Okay.
Okay.
And I think just for, what does it look like for a household? So for my household, it would be we couldn't go to work. For a household that has children, its children can't go to school, parents have to stay home from work. And when we think about here, what would it look like for a workplace? You'd have significant amount of staff having to stay home, and that sort of puts additional pressure on a workplace as well. And then you think about that, in a rest home, for example, when you get an outbreak in a rest home, lots of susceptible people for, getting really sick, getting, bacterial pneumonia, ending up in hospital. So that's how I kind of think of it, as what does it mean to me? What does it mean to my community? What would that look like? And so for all of us, although we want to get back to a level of normality, there is a need to do all the great things that we've done up until now. Simple things like mask wearing, hand washing, staying home when we're sick. And then the additional things like vaccination, registering our tests for COVID, having access to treatments for COVID, all of those things are going to be what gets us through what will be a really tough winter period for all of us. Not just the health system. You know, the health systems where we come from, and we talk about that a lot, it's going to be pretty hard for all of us, and that's sort of the context we need to keep it in.
Okay.
Yeah, so when we talk about hospitalisation rates, you know, the high hospitalisation rates we're expecting when we get these peaks of these viruses all potentially happening together, that's just the tip of the iceberg. It's telling us about what the community is experiencing, what families are experiencing. So, and I think that's sort of really understanding, that's what the modelling really means. We talk about hospitalisations, but actually it talks about what's going on in the community, doesn't it?
Absolutely, and then extra pressure on the hospitals, of course, because their staff are getting sick and staying away. So, you know, those absence rates, we have them in winter anyway, but then the COVID will add to this winter.
Okay, so on influenza, for example, the fact that we're starting to see cases already is, you know, that's definitely something to be mindful of. I understand we've been told a lot that this could be a particularly severe flu season. I'm wondering, Anthony, maybe you could explain, why do we think that this could be a bit of a doozy?
Yeah, and I think Gary just mentioned it before. We haven't had influenza circulating for, you know, almost 3 seasons now to any great degree. And so when we look back to, you know, 2019, we did have some flu. 2017 was our worst flu season for a decade. And then 2020, 2021, the borders were closed. So we're coming in with a relatively, what we would say, immune naive population. They haven't had any natural immunity from circulating virus. Flu rates have been low in terms of vaccination, definitely last year. 2020 was a relatively good year. So that's why we're quite worried. It will hit the population, it will make people sicker than they've maybe felt before. And we're already getting anecdotes of that from overseas. If we look to Australia, people saying, gosh, I didn't have COVID, but I had something else. I had a really bad viral illness that knocked me out. And I think we probably have all seen that, whether it be on social media or just in commentary turn up.
Sure, okay.
Yes, the Australian influenza isolate numbers have shot through the roof, so we'll be following on probably a week behind them. Yeah, so I think it's going to be quite significant, and I've got my vaccination for sure.
Yes, I was going to say that this is where the opportunity is. So we've got really good flu vaccination available, and I think that's really the key message, is particularly if you are eligible for free flu vaccine, which means we understand that you may be more vulnerable to severe flu. Then please get your flu vaccine, because that's actually the simplest thing that people can do to really protect themselves and protect their community, is to get their flu vaccine. I think that's a really important message here, really positive message here. Is that something we can all do?
Great. We had a few people get in touch, actually, just dovetailing off the need to get your flu jab if you can, you know, if you can afford it and if you're eligible for a free one. Just about generally boosting your immunity. So things like vitamins and zinc and echinacea and the lot. I mean, what do we know about these sorts of products for immune support?
The one thing to recognise about a lot of vitamins is vitamins are good for people who are vitamin deficient. So if you're deficient in vitamins, there is a relationship between immunity not working as well. For the vast majority of us, we're actually not vitamin deficient, and we don't require vitamin supplements. And so we talk about just simple things, getting all of the nutrients and vitamins through the food that you have, rather than needing supplements.
Right.
And I think it's not just about boosting your immune system, and I mean, it's about, you know, a good diet, getting sunshine in winter, which is important to boost your vitamin D. So that's some things that people sometimes forget about in the middle of winter. You're working all the time, you don't get enough sunshine, so go and sit out in the sun for lunch. But it is the basics, getting the basics right. But it's really important that we actually do the things that we know really, really make a big difference, and that is the vaccinations. To be honest, that is the simplest answer here.
Yeah. Sure. So on vaccinations, I've had a few different questions come in, flu, COVID-19 and others. One from Philip. Philip is 67, he's in good health. He had his COVID-19 booster in December. He's asking if he should get a second booster, and if so, how he would go about doing so when it's possible.
Yeah, so this is a really good question, and it is something that we see overseas data on from the US and the UK, even more locally from Australia, about when is the optimal timing for that second booster for us, for someone who may be older than us and have long-term conditions. It's probably going to be announced within the next couple of weeks where that perfect timing is, and a lot of these things are not necessarily perfect given the fact we're just about to go into winter. So if we look at the modelling, where a lot of people want to know now so they can get their booster in preparation for it. So there are a couple of cool tools out there, and the CDC has one, and you enter in all of your data and it says yes, based on US data, UK data, we think you should get a booster, and it gives you an indication of the interval from your last booster. And what we will see is our guidelines and our criteria will reflect the same sorts of things. If people want to get a second booster now because they're at risk, some people are travelling and they want to get their booster, you have to get a prescription from your doctor, go through a consent process before you can do it. So it is possible to get it, but that's a process you have to go through at the moment.
And what do we know about who might be eligible for the second booster when it does become available? Is it a targeted group?
It will be a targeted group. For young, well people who have had one booster, it may not be the now thing. They may not need it at 6 months because they'll have that severe illness, hospitalization protected then a bit longer. Once you get older and you have other conditions, your immunity doesn't work as well, or even a slight shift in your immunity has a bigger impact on your illness. So I suspect it will apply to those people.
Okay.
It's really important to recognise in our Auckland data, when we've looked at this Omicron outbreak that we've had in February, and we've looked at people by age group and various other factors, but what we can see is that actually the older you are and whether you have other underlying health conditions, the more important that booster dose was. So we're just talking about the original booster dose here, and we can really see an effect within our own Auckland population. So we talk a lot about overseas data, but we can see it very much in the New Zealand data. So being compared to being unvaccinated, but also even just the 2 doses, being that boosted made a huge difference, particularly for our older or more medically vulnerable population. Yeah.
In terms of severe disease?
In terms of hospitalisations, which is an indicator of severe disease. Yeah.
And even getting a booster after if you've had an infection, getting a booster after that can actually be a big fillip to your
Yes, yeah, that was into the next question actually. A woman named Georgina got in touch. Her son had COVID last week and he's fully recovered. He's booked in for his flu vaccine next week. She's asking, is that okay, or does she need to stagger having COVID-19 infection with the flu vaccine at all?
So no, once you've recovered, you can go get your flu vaccine. And obviously, as we're talking about flu cases turning up, so earlier the better to get that protection on board. The one thing about once you've had COVID, it's the timing for your booster. And so the timing for your booster after you've recovered from COVID is 3 months.
It's important to make the reason for that is not that your body is not ready to mount a nice immune response to your vaccine, but what we know is if we space it out a bit further, then your body has time to sort of settle back down, and then you're reminding it again and creating a nice strong response then. So that's the reason why. It's not a problem, per se, other than it gives better protection if you wait that 3 months.
Yeah, sure.
Getting the greatest mileage out of it.
Yes.
Bang for your buck.
each jab that you have.
Yes. It's a reminder. Each time's a reminder.
Sure.
And your body gets better and better at it, essentially.
Okay. We had another question from Ruby. Her 11-year-old daughter got her first HPV vaccine earlier this month. She's wondering if there's a recommended waiting period between the HPV vaccine and the flu shot, or the HPV vaccine and the COVID vaccine. To the floor.
So what we know is that when we've co-administered COVID-19 vaccines and other vaccines, apart from something the shingles vaccine that you get when you're over 65. That's the only vaccine where we recommend a spacing.
Right.
Otherwise, all vaccines related to COVID and flu can be co-administered. There is one unfunded flu vaccine and the Novavax COVID vaccine that we don't give simultaneously as well. But these are sort of minor points. For the vast majority, you can have them together.
It's really good to just pick up on the fact that she did go and get her scheduled HPV vaccine, and I think that's really important to remember, along with actually the COVID vaccines and the flu vaccines and these vaccines that were sort of quite topical at the moment. Actually, our scheduled vaccines that our kids need to get, that adults need to get, are incredibly important too. And I think particularly thinking about our babies and toddlers that are maybe overdue for their vaccines, that's the best protection they can get over winter against those infectious diseases too. So it's really important that this is the opportunity to get into your primary care practice, maybe for the older age groups into the pharmacy, and get you up to date with your vaccines.
Yeah. Sure. Actually, talking about little ones, I wanted to touch on RSV.
Yep.
So last year, obviously, we saw a pretty significant spike in RSV cases after a couple of quieter years. Gary, this might be one for you. Could you sort of talk us through what we are anticipating this year? Is it likely that we'll see a similar significant outbreak, or is it less likely because we did see that last year?
Yeah, so the modelling's taking two punts. One punt is, yes, we'll get the same as we had last year, based on the fact that a whole pile of people still didn't catch it last year, so there's still enough of a susceptible population. The other model, so that's the high scenario. The low scenario is, no, we did get enough people managed to catch it, so therefore it's be more like a regular year, so that's the low scenario. At the moment, the hospitals are planning on the high scenario because we actually think it's still uncertain, and that's what we need to plan for. And the first isolates of RSV are starting to appear now, so again, it's probably coming earlier, like it did last year, so it's going to probably peak at the same time that flu is, worryingly.
What do we typically expect to see, say, a pre-COVID winter with regard to RSV? When do we normally see these isolates being picked up? When is this happening?
It's normally more a June and July kind of pattern, June, July, August, the colder months. Sometimes it comes early at the end of May, but more generally then. So this will be on the early side of our normal kind of winter peak. Yeah.
And is that again because we are largely sort of immune? Naive.
Yes, because of that susceptible, and people are bringing in possibly new variants of the virus. RSV changes very slightly from year to year, so we're getting variants that are coming in on the planes will be slightly different than the ones that we had circulating several years ago when people last had their immune bump from RSV.
Right. Yeah. Is there anything with regard to RSV specifically? Is there a vaccine available? Are there efforts underway to create a vaccine? What's going on in that space?
Yeah, there is a lot of interest in vaccination for RSV because, it does affect some of our most vulnerable, our preterm babies, our young children that have chronic lung disease, and we've already talked about bronchiolitis, which is just what happens when, a normal child potentially gets hit with RSV. So a lot of interest in this area. There are other treatments that are also available for our really high risk preterm chronic lung disease, congenital heart babies and infants, which is a monoclonal antibody designed to ward off RSV. And that was something that was introduced in previous seasons, but recently we've just had the access of that widened to, again, protect those that are most vulnerable in our community, not going to intensive care, for example. So for those populations, they'll be talking to their doctor about it if they had it before, and a lot of their specialists will be reaching out to them to get them covered as well.
Okay. Now talking, I suppose, about the upcoming winter and just keeping yourself well and safe. Stephen got in touch. Stephen has been hunkering down and avoiding people to avoid COVID after heeding advice that it's not a virus that you want to get. He's asking though, is there a point in time where people who haven't been exposed to COVID will be putting themselves at greater risk because they are they have that lowered immunity because they are more naive towards the virus. Is that a concern?
Not really. I know we've talked about this in terms of not having circulating virus to give us natural immunity, but in the case of the reason we vaccinate people is to borrow that immunity. And the reason that we want to borrow that immunity is because we know that through vaccination we're much more likely to not get sick if we have to get the illness. So a lot of people who are more vulnerable don't want to just go and get it over and done with, because for them it may be quite a large illness.
Yeah.
I think just going back to sort of what we call first principles is that you do need to exist in your community and society, and so it's like all of those things that we can do to protect Stephen and what Stephen can do to protect himself, mask wearing, hand hygiene, thinking about where you're going and the types of activities you're undertaking, staying at home if you're unwell, going back to work, school, out when you've recovered. All of those things are some of the best defence that we can all do. On top of that, there's the ability to do treatments like vaccination. So think about it as all of those measures that we can do, and not to lose sight that all of those things really help, both at an individual and a community level.
And some people seem to talk about natural immunity as if it's better than the vaccine immunity, and of course it's not. It's much weaker, and it tends to wane a lot faster than the vaccine immunity. So after about 3 months, you're becoming pretty much susceptible again. It's a bit like when you catch a cold each winter. You don't think, oh, I've caught a cold, I'm safe now for the rest of the winter, because the colds come in so many different varieties. Omicron's a bit like that. It can sneak around your defences and catch you again.
Speaking about that, actually, what do we know about reinfection from COVID-19 in New Zealand? Our Omicron peak was, a couple of months ago now. What's happening here?
So reinfection in the first 3 months after having COVID is incredibly rare. If we were to keep the same strains that we have, BA1, BA2, and what we are seeing is that there are reports of people saying, oh, I got sick again, but they test negative. That's probably another one of these viruses circulating that's starting to crop up now. Then there's the concern from other variants that may arrive, so BA4 and BA5, and they obviously make us think, well, reinfection at an earlier time, because it can escape previous immunity, is something that may cause early reinfection. Again, another good reason to get vaccinated, because A, we can see at the moment that probably still affords people some protection against these newer strains. So, just as Gary said, natural immunity isn't the be-all and end-all, hence why we see people getting reinfected with variants. But, a lot of interest is around how much protection our current vaccines give us, and also what the new generations of vaccines could do in terms of giving us better protection.
Could you actually talk to that? What's happening with regard to an Omicron-specific variant? An Omicron-specific vaccine.
Yeah, so all of the vaccine manufacturers are undertaking trials to look at this. So it's beyond just Omicron BA.2, but looking across, because it has been a relatively short time. We started with 1 and 2, and now we're 4 and 5. So we're looking across that spectrum to say, okay, we don't want a situation where it dropped like for Delta and dropped again for Omicron in terms of needing that booster. We want something that's effective, stays highly effective, because that's really important. And also, a lot of these vaccine manufacturers are looking to places like Africa, where a lot of these variants are sort of taking hold as well, and saying we really need to vaccinate these populations with something that's user-friendly, not ultra-cold things, so that those populations are protected, because that's where variants tend to come out of.
So ideally we'd love to get to the flu vaccine and multivalent vaccines, which are for multiple strains. So the flu vaccine's 4 this year? Yeah. So that would be ideal for COVID.
I think there are some other vaccines though. For example, we've got the measles vaccine, the MMR vaccine, which the measles doesn't evade that vaccine. It's a very, very effective vaccine, and I think the thing that also to remind is that actually we may get measles coming through the border this year, and I think it's really, really important for us to think about what it would look like actually if we got a measles outbreak on top of our COVID, influenza, RSV. And
You're just trying to cheer people up, aren't you?
I know, but I think the thing is here that is a highly effective vaccine, but we do know that we have a relatively susceptible population. We saw that in the 2019 measles outbreak, which unfortunately travelled from New Zealand to Samoa. And I think this is the opportunity then to look at the MMR vaccine too. And some people will be getting invitations now because they may not have an MMR vaccination on record. So it's just really important to recognise that's another opportunity that we can do as a community to really protect ourselves, protect each other in the community, but also protect hospital resources to make sure the hospitals are there for the things that we need them for.
Yeah, sure. Does measles have a similar seasonality? Do we think of it as a winter virus, or is it well, any time?
Yeah, measles is a bit more tricky. It's really outbreak focused, so you get some cases coming in, it gets hold in the susceptible populations that are not vaccinated, and then you spill over into outbreak. Very infectious, and that's why, you know, just like with COVID, a lot of our models were based on how we manage measles in terms of, you know, masking, distancing, isolating and things like that. So there's a lot of things that are similar, but I completely agree, you know, highly efficacious vaccine. And Christine always reminds me of other things like don't forget whooping cough. So going back to getting back on schedule with all of those other things to protect yourself from anything that could arrive on our shores now the borders are open.
I think it's important to recognise that, you know, we've as a country also struggled to get scheduled vaccines in, and actually a lot of the time we weren't as COVID affected as other countries, but other countries have been very COVID affected and they are also behind in their scheduled vaccines. And so globally we're seeing, you know, these viruses that, you know, the measles cases, you know, and just we need to be aware of this, that it can come across our borders now and to our population.
Okay.
Yeah.
So finally then, with the borders open, with the fact that we're in May, we're starting to see some flu and some RSV perhaps earlier than expected. We could have another Omicron wave on the horizon. We've touched on a couple of these bits already, these top tips, but how should people best protect themselves in the coming months? What should people do in a material sense to best look after themselves? One for the floor.
So I'm going to buck the trend just because I usually talk about vaccinations. I won't mention vaccinations, I'll leave that to the other two. I think one of the things that's really important is keep up your mask wearing. You know, respiratory viruses are passed through particles, aerosols, and masks work to dampen that transmission no matter what the virus is. And that's a really simple and effective tool that over the last 2 years, although it's been a pain, it has been something that's been highly important for reducing transmission. Now people are moving around a lot more, it becomes even more important. It's not the opposite when we're all staying at home, isolating, not going to work. That it added something, but it adds so much more now with people moving around so much more. So definitely keep up with your masking efforts. Definitely think about it in places like schools should be thinking about, is there something that we can support students and families to be able to mask in the learning environments. You know, workplaces, you know, we do it in hospitals, but whatever setting you're in, think about that.
Okay, key messages. I think the first key message from me really is that primary care, which includes your general practice, your pharmacy, your midwives and so forth, are all there ready to care for you. And I think it's the opportunity now to get ahead of winter and make sure that you are up to date with your medicines, that you're getting the right health checks that you need, that babies have had all their vaccinations, really, really critically important, I think, is actually let's get ourselves in the best possible position we can be as a family and as a community for what's coming ahead for winter. So I think that that's my key message really here, is that our wider primary care are really here to help and to provide that advice and to get those vaccinations up to date. So yeah, I'll take the vaccine one.
Yeah.
No, that's Susan Gary. Well, that's all we have time for. So thank you all very much for being here today. Thank you to those of you who sent through your questions. It is greatly appreciated. Take care of yourselves. Ka kite.